Hi there, my name is David Little and I'm one of the radiology consultants that curates Bath Radiology Education. I'm going to run through this really tricky case that I posted earlier and show you the abnormalities. So we've got a 20-year-old who's presented with severe right-sided abdominal pain and suspected renal colic. So we've performed a plain CT-KUB. And these are the images that you were presented with. And on an initial scroll through, there isn't really much to see. In this context, one of the first places you're going to want to look is in the kidneys for any renal calculi. And following that right ureter down, anterior to the psoas muscle, we kind of lose it in there a little bit. And down into the pelvis. And I can't see any urinary tract calculi. There's a little bit of presumably prostatic calcification down there. So then it's a case of looking at everything else. And other key causes of right-sided abdominal pain are going to be appendicitis. So you can see the appendix just there, which is normal in caliber, and there's no real inflammatory stranding around it. So it doesn't look like appendicitis. As you're scrolling through, you might catch your eye that in the right upper quadrant there's a little bit of subtle inflammatory stranding in the fat there. And as I scroll up and down, I think you'll agree if you compare the fat over here to, say, the fat over here, it's a little bit more dense on this right-hand side. There's also some subtle peritoneal thickening there. When you see fat stranding, you need to look really closely at the structures around it to see if there's any potential cause. So again, in the right upper quadrant, we're going to look at the gallbladder. A little bit difficult on a non-contrast CT-KUB, but it doesn't look obviously abnormal. And in fact, a lot of the fat around the gallbladder is normal. There's no obvious gallstones. What about the bowel? So the bowel adjacent to this area, again, slightly limited by the lack of contrast, but it looks grossly normal. It's not particularly thickened to account for that inflammatory stranding. So all we're left with is the subtle stranding in the fat, a little bit of peritoneal thickening, and potentially a little soft tissue density in the center of that. And this is a case of omental infarction. So this is an area of the omentum and peritoneum, and the fat there is infarcted, and the soft tissue density in the middle there could be the thrombosed vessel and the cause of that. And this is an uncommon presentation, but tends to present with really severe abdominal pain, often in young men, often very fit patients, marathon runners, cyclists. And it's a benign self-limiting condition that doesn't need any further intervention or any operative management. It can be managed conservatively with no significant complication. So yeah, that's the case of omental infarction. It's a really subtle abnormality, but something to look out for on call. Hope you enjoyed the case, and if you have any comments, do post them on Twitter.